One thing that often worries parents during fever is this. Your child's forehead and chest feel hot, but the hands and feet feel cold. Parents ask, "Doctor, is my child's circulation failing? Is this dangerous?" Today I will explain why children get cold hands and feet during fever, and when you should really worry. First, let me reassure you. In most cases, cold hands and feet during fever are normal. Let me explain what is happening inside the body. Fever is controlled by the brain, by a small center called the hypothalamus. When the immune system detects infection, it tells the brain to raise the body temperature. To do this, the brain needs to conserve heat. So the brain sends signals to narrow the blood vessels in the skin, especially in the hands and feet. When less warm blood flows to the skin, those areas feel cold. At the same time, heat is preserved in the core, in the chest, abdomen, and brain. This helps the body reach the higher temperature needed to fight infection. This phase usually happens when the fever is rising. That is why you often see cold hands, cold feet, shivering, and your child asking for a blanket at the same time. Now let me explain what happens later. Once the body reaches the new temperature set by the brain, the blood vessels open again. Then the child starts to feel warm all over and may even start sweating. So cold hands and feet followed by warm, sweaty skin is a normal fever pattern. Now let's talk about when you should worry. Cold hands and feet are usually not dangerous by themselves. But you should seek medical advice if they are accompanied by child is very lethargic or difficult to wake. Breathing is fast or difficult. Lips or tongue look bluish or pale. Child is not drinking or passing urine. Skin looks mottled or gray. Severe pain, rash that does not fade, or seizures. These signs suggest something more serious than simple fever. Parents also ask, should I warm the hands and feet? You can keep your child comfortably warm, but do not overwrap or overheat the child. Light clothing and a normal room temperature are best. Now let me leave you with a simple line to remember. Cold hands and feet during fever usually mean the body is trying to hold heat inside to fight infection. Understanding this can remove a lot of fear. If this video helped you, please like, subscribe, and share it with other parents. I'm Dr. Yatin Bhole.